Welcome to a live chat with Nurse Linda. Linda Schultz is a leader and provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 2 decades. Now I'm going to turn it over to Linda. Hi, Linda.
Hello, thank you, and good afternoon, and welcome to my home. It's always nice to spend this time together with you. We'll be answering some questions. I wanted to start off talking this morning about autonomic dysreflexia and other things that affect individuals who have problems with their autonomic nervous system. That's been the topic on the blogs this month, so I thought let's hit a little bit of that. But first, I want to welcome all of our regular viewers and new people. I know that there's been some questions about can people with other diagnostic types join into the conversation, and most definitely. What we're talking about is all issues surrounding paralysis. So no matter what the source of your paralysis is, you're welcome to join in and ask questions. It might be a little different for some people, depending on the source of their paralysis. So some people have paralysis from spinal cord injury. Some people have other diagnostic groups that classify as a spinal cord injury, but are not really thought of as a spinal cord injury, like people with MS or cerebral palsy, Parkinson's disease, Friedreich's ataxia, cerebral palsy. Did I mention that one already? I think I did. And so there are other people that have paralysis from other issues, people who have stroke, and you're all certainly welcome. The functional outcomes of paralysis and the treatments are the same. Cures might be different, but in the meantime, we live in the here and now of today. And so talking about how we can help treat and control issues with paralysis is an important issue for anybody, no matter how you tend to identify with whatever disease process you have. So today I was going to talk about the autonomic nervous system, which is the part of the nervous system that happens automatically in the body. So people don't really think about some of these body processes, but you sure do get a sense of them when they go haywire. People who have issues in their spinal cord generally have more troubles with the autonomic nervous system, but people who have MS is usually have more lesions in their spine actually than in their brain. So a lot of people don't know that, but that's why it's classified more as a spinal cord injury. People who have stroke have the source of the problem as an issue in the brain as opposed to the spinal cord. So it's an issue with development of the message that needs to be sent and receiving the message in the brain, versus in spinal cord injury, it's the transmission of the message. So it doesn't matter how the problem occurs. What matters is what you need to do about it and how you can get moving forward, even though you have this. So the autonomic nervous system is very complicated. The nervous system is just so complicated. The whole body is just so complicated, and we really know very, very little about it. We know a lot, but we really know, in essence, very little. And so I'm just going to put up, share my screen with you for a moment. This worked last month, so let's make sure it works again this month. So this is a little thing I put together about the autonomic nervous system. So here you can see this is the whole nervous system. The brain and the spinal cord consist of the central nervous system that communicates back and forth with the peripheral nervous system. These are all the nerves outside of the brain and spinal cord. So the nerves that run down your arms, the nerve that go to your heart, the nerves that goes down to your toes, all those nerves are in the peripheral nervous system. And that's divided up into two different nervous systems, the sensory and the motor division. The sensory is how we feel things. So you might feel things in your body, on your body, in your body, in the viscera, or is inside your body, in the core of your body. So that's getting those messages to and from the body or from the skin on the outside. And then there's the motor division, and this is the part that makes your body move, and that consists of the somatic nervous system, and then there's this autonomic nervous system. So the somatic is the things you think about. I'm going to get up and walk, my legs are going to move, and my toes are going to move, and all these kinds of things. The autonomic nervous system, now people don't really sit and think about every single movement that they make, but basically their mind is constructing a movement pattern when they move. The autonomic nervous system takes care of everything that happens inside your body that you don't think about, but it just happens. The easiest one to think about is how your heart beats. And your brain doesn't have to sit there and say heart contract, heart release to get the blood to pass through the heart. It just happens. And same thing like with breathing, it just happens. You can override your breathing function. You can hold your breath, but if your body determines, if the autonomic nervous system determines you need to take a breath, you will take a breath because it will cause that to happen. So the autonomic nervous system has the parasympathetic and the sympathetic divisions. It breaks down into even more. And I have this schematic, which is very complicated. Oops, it's kind of gone. It just disappeared. There we go. So it has all the different things, and there's more, but this has a good idea of all the things that the autonomic nervous system controls. The parasympathetic nervous system kind of slows things down when you get, too energized or you're overactive about something. And the sympathetic nervous system kind of speeds things up a little bit.
Linda, sorry to interrupt. We can't see your slides right now.
Well, then, all right. Then we'll just forget that then. We'll go back to regular. So thank you for telling me that, because, that would be pretty boring if you couldn't see it. So basically, the autonomic nervous system controls all these functions in your body that you don't think about doing. So if you think right now, I'm speaking and I have saliva in my mouth, that's the autonomic nervous system that's controlling the amount of saliva I have in my mouth. The autonomic nervous system controls your heart beating, your lungs breathing. It controls your liver working. It controls all your glands functioning. Everything that happens, we don't even think about these things. Autonomic nervous system controls sexual function. If you can believe that. It just controls just everything that's in your body. And when it's working fine, great, it's doing a good job, everything's going along just fine. When you have a spinal cord injury, sometimes the message from the central nervous system, the brain, can't get through to the part of your body that's been affected by paralysis. So you see, there is a problem, because those messages might be interfered, they might become slower. That's why why you can't sense things, why you can't feel things on your body, why you don't have sensation. You can see that on the outside of your body, but what we don't think about is on the inside of our body, things are also being slowed, or those messages aren't getting through either at all, or they aren't getting through correctly. So those are all some issues. Some of the big three things, there are many, many things that happen, but when the autonomic nervous system is affected. But some of the big things that happen after spinal cord injury, number one is autoregulation of body temperature. So when it's cold outside, it's getting to be cold now. The weather's turned really cold where I am, so it's been quite a shock this week. But what happens is that the message can't get from the brain that tells your body, oh, it's colder outside. So to keep warm, we're going to contract the blood vessels so that they get smaller, so there's less surface area, which causes less chilling of the blood in your body. And since that's circulating all throughout your body, you want your blood to stay nice and warm. So those vessels will get smaller. So the blood will stay warmer because they contract inward towards the body. So things that will help. And the other thing is, when you get cold, your body, you'll know, will shiver. And so the shivering stops when that message can't get through the autonomic nervous system. So people who have spinal cord injury tend to have problems with regulating their body temperature. So if they get exposure to cold, they don't have those automatic responses, and their body gets much colder much faster and then can't reheat itself. So it's important to dress for the weather. I know I see a lot of people that go out in the world, and I see, well, not this year, but when we had high school football games and we would go, there was one gentleman that went to the high school, and he's older now, he has a spinal cord injury, and he always comes in shorts, and it'll be snowing outside. He comes in shorts, no shoes, no socks. He says, well, my body doesn't feel it, so what difference does it make? Well, your body doesn't feel it. You're not getting that message to your brain that your body's cold, but your body is still reacting to it. So that cold is still penetrating his body, affecting those blood vessels, affecting the skin, causing frostbite to the toes, because that heating mechanism can't be internally turned on in the body. So you need to wear protective clothing from the cold when you go out. And when you do go out, if you're using a wheelchair, so this affects anybody, no matter what the source of your issue is, be sure that you dress the backside of your body. Sometimes people, they put their coat on backwards so that it's like a blanket over the top of them, which is nice and comfortable and warm. But what they aren't thinking about is their backside is up against the wheelchair, which is made of metal, which is conducting more cold. It's holding it in around your body. And then the seat's usually some kind of vinyl, or your pressure reducing equipment that you're sitting on is some kind of man-made material, and that's also holding in more cold. It doesn't heat up along with your body. So when it's really cold outside, be sure and dress warmly on the back side of your body as well as on the top side of your body, even on your legs. Sometimes people put a blanket over their legs and it's hanging over the side, but the whole back of their legs are exposed to the elements, besides, of course, their clothes. So be sure and do that. Sometimes after a spinal cord injury and you go outside and you get too cold, same thing in the summertime, if you go outside and you get too warm from overheating your body, that thermoregulation in your body can occur. And so you have to come in, try to put more blankets on. Shivering isn't happening, so you aren't generating heat in your body. And it just seems like you just can't get warm, and it might be hours and hours and hours. Another way to generate heat is through movement. So if somebody can move your body, if you cannot move parts of your body, if somebody can move them for you, that can help generate some heat too. But most often when you get over cold, what will happen is that you won't get warm until you go to sleep, take a nap or sleep that night. And then your brain kind of resets when you're sleeping, and the autonomic nervous system will reset and the temperature evens out. So people who get hypothermic are very uncomfortable for a very long period of time. So it's good to just not let that happen to you. So try to stay close to warmth as best that you can. Another big issue with the autonomic nervous system is autonomic dysreflexia. And I'm going to, I'm not going to, but Jen is going to, from the Paralysis Resource Center, is going to put up for you the location of the Reeve Foundation wallet cards. And one is about autonomic dysreflexia. There's one for adults, and there's a separate one for children. And it's in a variety of languages. These wallet cards, there are several of them. There's AD, sepsis, and deep vein thrombosis. They're just the size of a dollar bill. They're trifold. They fit in your wallet. That's why they're called a wallet card. They're free to use, so you can print that off. And if you go to your healthcare professional, if you have to go to the emergency room, if you have to see a physician that's not that familiar with people who have spinal cord injury, it's interesting being a nurse. I'm a nurse researcher, rehab nurse for a number of years. But so in my world, autonomic dysreflexia is, I see it almost every day. But in the milieu of healthcare, there are very few people that see individuals with spinal cord injury. They may have learned about AD in school, but maybe they've never seen a patient, maybe they've been practicing for 20, 30, 40 years, and they've never seen a patient with spinal cord injury. And so it's kind of like, well, I sort of remember this. In nursing school, nurses get 1 hour of education about AD, but they've probably never seen anyone who has a spinal cord injury. So they've never really seen what this is like. But if you have a spinal cord injury, it usually happens with injury above T4, T6. But there's a lot of new discoveries that's going on with autonomic dysreflexia. And they're finding that if you have lower level injuries, you can still have some of the symptoms. So what is this? Well, it's a quick elevation of the blood pressure. And what happens is something below the level of your injury is bothering your body. And as I say, your body still reacts. So it's trying to get a message to the brain. Your catheter's kinked, you have a bowel impaction, you have a pressure injury, you have an infection. Sometimes people have a gallbladder attack and their level of injury is above their gallbladder. They might get AD from that. It can be from your shoes being too tight. I see a lot of people who put their leg bags on, and when they put their leg bag on, it's nice and loose hanging around their leg. But as it fills with urine, that strap around the leg gets tighter and tighter and tighter. So that can be a cause. So, they started out, they were fine. Their leg bag was loose. But as the day wears on, sometimes, they get swelling in their leg, which makes the bag tighter. The urine is in the bag, it gets tighter. That happens. I've seen cases of AD from all kinds of weird things. People are getting a lot of AD from looking at their computer screens too long because it has that light that kind of lights and dims. You can't detect it with your eyes, but it's behind the screen. There's this change in the light. And so people are having AD from looking at their computers or their phones too long. If your computer is next to a high power usage piece of equipment, like if it's next to a refrigerator, or I one time had an office in a building that was right next to an elevator. And every time the elevator would go up and down, and when it would pass by my floor, the screen would get lighter and darker. And I could see this with my eyes. And so you might have something like that that's going on. Now, people don't really know they have AD until they have one of the symptoms. And but when they have AD, their blood pressure raises between 20 and 40 points. So if you have the symptoms of AD and you decide you need to go to the hospital because you're trying to release whatever pressure or whatever stimulus is bothering you, sometimes people go to the hospital. I'm having an autonomic dysreflexic episode. I need some help to control my blood pressure. They take your blood pressure after spinal cord injury or after paralysis on that part of your body, on that side of your body. Your blood pressure might be much lower than the typical blood pressure. So they take your blood pressure and they say, oh, you're 100/60, you're doing fine. You need to know what your average blood pressure is for you, because after spinal cord injury, your blood pressure might run typically like 80/40. And that would not be unusual. It gets very low. So to have an elevated blood pressure is still low in the normal population, in the averages of people in general. So it's good to know when your what your usual blood pressure is, so you can report that. If you take that wallet card, it has all the symptoms, what can be causing it, all different kinds of information, how to treat it. It has the gold standard research articles of how to treat it. So you can hand that to the healthcare provider. I think I might be having this. They can look at it. They can look up the references themselves, and all the information is there. It kind of takes the threat, I guess, out of the patient diagnosing themselves and then instructing the doctor. So it's kind of helpful in that way. So some of the symptoms that happen, this is all because it's happening in the autonomic nervous system, is you'll have this bump up in your blood pressure. You could have a fast or slow heartbeat, could be could be faster than usual, or it could be much slower than usual. People always know the symptoms, the pounding headache. Oh, I have AD because I have a pounding headache. It's a really severe headache. And if you ever have an AD headache, you will remember it forever. You will know what that symptom is. Now, sometimes people will tell me, oh no, I didn't have the pounding headache, but there are all these other symptoms as well. And not everybody has an AD episode that is this big, horrible crisis, pounding headache, blood pressure through the roof for that individual. Sometimes they might have a feeling of apprehension or anxiety, kind of this queasy feeling, something's wrong, but I can't put my finger on it. And if you get that real kind of just kind of tense kind of feeling, that could be an AD episode. Other things would be a change in vision. That's what a lot of people notice when they use their computer. My vision gets blurry every time I look at my computer. Probably AD. Some people get a symptom that is kind of odd, nasal congestion. And I've had people that will tell me, you know, every time I wear my skinny jeans, because of the constriction of the skinny jeans. And, you know, I read on the computer the other day that skinny jeans are out. And I thought, oh, hallelujah, because this has been such a bane of existence for me. It's your skinny jeans. So sometimes people get nasal congestion. Sometimes they get sweating where they didn't sweat before. Flushed skin, they might get, you know, real rosy cheeks, or they might get a red patch on their chest. They just might get flushed skin all over their body. They might get goosebumps. They might get a tingling feeling. You can have all of these symptoms, or you can just have a few of these symptoms, or you can have none of the symptoms and you can still be having AD. Below the level of injury, if you're having some other odd kind of symptoms that will appear below the level of injury, you might have some nausea, you might have chills, but no fever. You might feel clammy, your skin might feel very cool, and it might be, you might get extreme. Now, as I was saying, there's a lot of new discoveries in autonomic dysreflexia. And one of them is, it was found serendipitously by a person in one of the VA hospitals where they were doing exercise in that population. So they wanted to see how it affected blood pressure. So they had people, while they were patients in the spinal cord injury wing of this one VA hospital, they had the nurses take people's blood pressures every so many hours while they were in this exercise program. And what they found when they went in at night was that people were having AD episodes. They didn't wake up. They didn't know they were having them. They didn't have pounding headaches. They didn't have any of the symptoms, but they found that people were having AD episodes, and the higher the level of injury, the more risk of having AD, and they called it silent AD. So they're starting to do a lot of investigation into silent AD, because as you probably know, people who have spinal cord injury have a higher risk of cardiac problems later in life. And if they're having AD episodes and not knowing about it, this could be affecting their cardiac status. So pretty important piece of information to gather. If you don't treat AD and you leave the blood pressure, keeps going higher and higher, you can end up with seizures, you can have a stroke, you can even die. So it's very important to get it treated. If you're having the first thing to do if you have an AD episode is to raise your head up as quickly as you can. So if you're laying down, raise the head up, which triggers orthostatic hypotension. So it drops your blood pressure right away. That gives you a few minutes to look for what the problem is. Is it the catheter is kinked? Is it clogged? There's no urine in the urine bag, something's wrong there. That's the number one reason why people have AD. Other issues, as I say, you can check the bowel, you can check to see if something's too tight. Sometimes people who don't have good hygiene with their toenails, and their toenails get too long. Sometimes when they put on their shoes, then the toenail gets ingrown, and that can cause an AD episode. So just about anything that's bothering your body. Some people are so sensitive if they lay on a wrinkle on their sheet, or even if just a breeze in a current in your house. If a breeze blows by you, it can trigger an AD episode. So very important to know what that is and how to treat that. If you have recurrent episodes, you'll need to have some emergency treatment on hand, so you don't have to call 911 every time and go to the hospital, because that's a long time before you get treatment. Some people will prescribe nitro paste, which it comes like in a tube of toothpaste, and there's a little tab of paper, and it has like a measuring strip on it, and you usually take 1 inch and you put it on your body somewhere where you have sensation. A lot of times people will put that piece of paper with the tube of nitro paste strip just right on the forehead, because then it can be absorbed into the body, because most people will have feeling up in their forehead. After the AD event is over, you need to wipe off that, because you don't want to keep lowering your blood pressure. So you want to wash that off after it's resolved. There is another medication called Nifedipine that can be taken 10 milligrams in your mouth. You can put it under your tongue or you can chew it, and that will help lower the blood pressure. If you do end up in the hospital and they're having trouble getting it under control, you might end up on blood pressure lowering medication through an IV. Sometimes it can be that serious. So there are all kinds of treatment. There are some treatments that people will put, healthcare providers will put people who have a lot of recurring episodes on, but that's pretty rare. It's usually treatment by treatment. But if you do have enough episodes, you will be get treated for that. So after it resolves, you need to monitor yourself for 2 hours if you're still at home doing that. And people often do stay at home if they've had it before in the hospital. They know what the treatment is. They know how to fix the problem. They know how to treat the problem. If it's not resolving, then you do need to call 911 if you're used to treating it at home. Another thing that the autonomic nervous system does is it works with control of your immune system. And so this is important right now, especially in this time of COVID, but it's important at any time, because your immune system can be affected by the white blood cells are always traveling around in your body. If they see an invader, which could be a COVID, it could be any flu, it could be any bacteria, and they see any kind of invader in your body, they recognize it, the white blood cells will start to react and just try to destroy the invader. After spinal cord injury due to the autonomic nervous system problems, the white blood cells might not be able to react quickly enough to notify your brain, hey, there's an invader in the body. The brain then notifies the liver, oh, we know this invader, so let's send some naturally made antibodies to go kill it off. Or the body won't be able to make those antibodies quickly enough. And then outside antibiotics have to be taken. Although antibiotics don't really work for viruses, that's why we get vaccinations, or we use antiviral medications. So the antibodies in your body might be able to help fight it off, but usually things become so overwhelming that you have to do something different. So just some things to think about for the autonomic nervous system, because you know, it's a pretty serious kind of deal. It can have some serious ramifications. So just to know that these things are out there, and that there are treatments, there are wallet cards that you can use to help get care. So let's do some questions, because that's always a fun kind of thing to do. So there's one here in the chat box, and I know that a lot of you have sent in questions previously. I'm still trying to work out my method now that you can see me, which is kind of nice, on how to read the questions as well. So I'm going to read this first one from the chat box, and it's about this person's brother's been in a nursing home for 4 years with a spinal cord injury. It's not a skilled facility, so he has no rehab. Recently, he became depressed and stopped eating, drinking, taking meds, and they put him on end of life and allowed the family to visit. Since then, he has started to improve. This is not uncommon with people who are living in extended care facilities, in that visitors were completely cut off. And family is the lifeline of people in facilities. So it's very important to visit. It's very important to call. It's very important to have contact. And also research studies have shown that people who have visitors in long-term care are seen as very important by the caregivers that are providing the care. Now, my experience with long-term care has been very good, both professionally and both personally with people in long-term care. It's been excellent. And I've not seen anybody ignored or neglected, but somehow when caregivers see that there's a lot of family members around, they recognize that this person is important to this group of people. And it seems to give the resident a little more cachet, so to speak. So it's important to visit. And when you're through this COVID, a lot of people have been removed from their family, and then you're just all alone. And so it's a very sad situation. So is there anything they can do to get him some rehabilitation, or is it just too late? Well, it's never too late. It is never, ever too late. Something that we know now is that the nervous system will continue to regenerate for your lifetime, just the same as your skin. We all know about skin cells that regenerate. So does every other part of your body, including the nervous system. It's just very, very slow. Now, they used to say that after 2 years, whatever you have is what you have after spinal cord injury or any nervous system injury, stroke, or whatever. However, the reason why they said that is because people were followed after spinal cord injury for 2 years, and many people did not get recovery in that time span because they weren't doing any therapy, they weren't moving their body, they weren't being stimulated in any way. And so the philosophy changed and people started getting recovery. And there's a lot of people, I point to Christopher Reeve, who after several years after his spinal cord injury, he developed movement in one finger, just a little tiny bit of movement in one finger. He called it his party trick. Look what I can do. But that stimulated this whole process. He's really the one that kicked off this whole new way of thinking in rehabilitation, in that we know that everybody gets return. It's just so very slow. And a lot of times people are put in a lot of positioning devices to hold their bodies anatomically correct, which is the right thing to do because you don't want to get contractures or shortening of muscles, and you don't want any other secondary complications of spinal cord injury or a paralysis. And so even if you can take that little tiny bit of movement and harness it, exploit it has is a word with negative connotations, but you want to exploit that little bit of movement. So he actually could propel his wheelchair using an adaptive device with that little bit of finger movement. Now, he did not do that publicly because he was not comfortable with the reliability of that movement. Perhaps as time went on, maybe he could have gotten more comfortable with that. And he had movement after going through an activity program, he had movement in every single joint of his body. I saw this with my own eyes. I know this is a fact. So he had movement, not always against gravity. So he couldn't always go like this against gravity, but he could go like this. So because you see, gravity is equal when you're going this way. This way, I have to pull my arm against gravity to pull it up. So if you think about that, and if you have that kind of movement, so it's never too late. People, no matter if you've been injured 20, 30, 40 years, there's still a chance. You just want to give input to your body, because as I say, your body is still responding to what's going on below the level of spinal cord injury. The brain is not receiving that message, but the body is still doing it. So if you can stimulate the body below the injury, that message can be going up the spinal cord till it gets to the injury site. Message from the brain, if you're thinking about, I'm moving my legs, thinking about that, even while you're doing range of motion exercises, when those two places meet at the level of the injury, something's going to connect sooner or later. So that does happen. It's going to be a breakthrough there. So So anyway, it's not too late. Now, how are you going to make this happen? You need to talk to your payer and call the number on the back of your insurance card. It does not matter if you're privately funded or if you're funded by the state. Call the number on the back of the insurance card and ask for a nurse case manager and ask where your brother can go to receive some treatment. Talk to your healthcare provider. If he's not seen a spinal cord injury specialist, he needs to see one. Unfortunately, the way insurance works is you can't have therapy forever in our country. A lot of people outside of our country think that people who have spinal cord injury are treated forever. But there are things that they can do in the facility, like range of motion exercises. There are things you could go in and do range of motion exercises to help. So there are all kinds of things that you can do, but talk to your payer, talk first to your healthcare provider. And if you say, oh no, it's too late, well then find a new healthcare provider, because that is not the way that people think about it now. It's a completely different thing. So there's a question here. Please list the quick acting meds to lower BP in the event of AD. And the one is the nitro paste and the other one is nifedipine. So those are the two quick acting ones. And the AD fact sheet has more information about that too. So a question that somebody wrote in, and now I'm going to be looking at my phone. So that's why I'm looking down here all the time, because these are where the questions are. So how to help a person with partial paralysis. Again, it's the same kind of thing, activity, activity, activity. So the more therapy that can be provided, the better. If the time of therapy is over, by your payer, you can still do a program at home. Now, pretty much everybody, no matter who your payer is, you get 2 weeks of therapy per year in your contract with your health insurance company. So use that 2 weeks of therapy to go and learn a home program, to learn how to get activity into your life, to go with a family member, to learn how you can move your arm or your leg. And then the family member, if you can't move your arm or leg, how the family member can help you, what kind of equipment can be used. Some people, I already know range of motion. Okay, is there some equipment? There's arm ergometers, there's feet spinning cycles, there's electrical stimulation, there's partial weight supported walking. Now, the 2 weeks of therapy might be limited to mobility therapy, but that can be learning to transfer in and out of your chair. That can be you learn to use a partial weight supported walker device. You're probably not going to be able to afford that in your home, but you can apply to your insurance company to see if you can. And these products are getting cheaper and cheaper. So, it's very important that you follow up and use that 2 weeks. Don't let that slip by. So be sure and use those 2 weeks and maximize. Talk to a spinal cord injury specialist to see what would be the exact right thing, what would be the biggest bang for your buck. Aquatic therapy is another thing. If your healthcare provider feels that it's safe for you to go into the water, some healthcare professionals don't want you in the water if you have a tracheostomy. Others will say it's okay as long as there's somebody there. You can't get water in that. That would be the worst outcome. But people with trachs actually do that, but they have to have somebody that's just watching that, protecting the head, protecting the neck. They might not let you in the water if you have an open wound. Some people won't let you in the water if you have a suprapubic catheter because of the opening of the feeding tube. There are ways to get around that. You can use a plastic secure dressing to cover that up so water doesn't get in that wound. So, don't cut yourself out. Think about, well, okay, I have this. Talk to your healthcare professional. Talk to them about what workarounds you might possibly be able to do, because there are ways that you can pretty much get around everything, unless you have a seizure disorder. And if you have a seizure in the water, you're not getting in the water, because if you have a seizure in the water, that is difficult for people who are protecting you in the water to manage. Now, there are a lot of public pools that have adaptive water therapeutic exercise places. The MS Society is very active. For people with MS, they needed a heated pool because their muscles contract when they're too cold. So if you're in a regular pool, the water might be too cold. So if you might want to call your local MS Society to see if there's a heated pool that people with MS are using. They would be happy to let you in at the same time, which is, nice that you get that. Where I live in the next county over, there is a city public pool, and they have adaptive therapies for adults and children, where they have people who come in that are trained in aquatic therapy. The man who came and changed the locks in my house was a very interesting guy. He was from another country, and we got to talking, what do you do? And he's changing the locks. And he said, well, in my other country, I was trained to be a pool therapist to help people in the water. And since I'm not certified here in the United States, I can't do that. So I said, well, why don't you advertise online and see if anybody would be interested in working with you one-on-one? He couldn't get a job in a facility, but maybe there'd be somebody interested in hiring you on a personal basis. And now he has a job where he does pool therapy with people that just hire him by word of mouth. They've had good luck with him. He does this therapy. And so it's turned out to be a good thing for him. Now, I'm not sure of all the legal ramifications. That's up to him to know, and up to you to know who's providing your therapy. So you want to be sure and check into all those kind of things. So, there's all kinds of ways to get therapy that you need to know. There might be somebody in your neighborhood that's a therapist. You might go on your neighborhood app. I'm looking for somebody who can help me in my home. They might be willing to come over and do it for free. You never know. Strange things happen. So be sure and use all your resources to see how you might be able to get some therapy. Some of the therapy centers, if you live near a rehabilitation hospital, they will turn their therapy area into a gym where you pay a nominal fee and you go in after hours and use the equipment. If you go down to any of the therapy the gyms that people, I'm thinking, I don't want to use product names, but Gold Gyms or any of those. Sometimes they have people who are used to working with people who have different ability levels. So, go to your gym and ask, do they have anybody who's used to that? Now, if somebody says, oh yeah, I've worked with a bunch of people. Okay, check their qualifications. Be sure they know what they're talking about. Don't just, sign up with somebody because they said they did it. Evaluate it. If it's not working out, you need to know, working with your therapist in that 2 weeks of mobility, you need to know what you can do, what you should do, what you shouldn't do. You are the owner of your body, so you are always in control of that body. There's Peter has written in, there's a heated pool at Courage at Kennedy Rehab in Minneapolis and in Stillwater, Minnesota. Still restricted due to COVID. Yes, we all have to wait for everything. You don't want to go into start something new in this time of COVID because of the immunity problems that people have who have any kind of paralysis. It'd probably be best to wait. We're only going to be waiting a short time now. We've already waited 10 months. And the vaccines are coming at warp speed, and they are. So, do your fact-finding information on the phone and see how that goes. Somebody else said, I wrote in and said, I have a stroke and am I eligible? You sure are, because, we're going to be talking about how to get help. And so that you certainly would fit more into that. A person here wrote in and they have a spinal cord injury at T8 and they want some suggestions for strengthening their spine. They feel as if their posture is weakening and bending. And you know what? This is a very good question because this happens. The muscles above the level of your spinal cord injury, no matter where it is, The muscles above are going to be working overtime to compensate for the muscles below the level of injury that are not working quite so well. So those muscles are going to be getting stronger and stronger. The muscles below, you can still do therapy and exercise and get them stronger as well. But the interesting thing about muscles is they're usually equal on both sides of our body, but in reality, they're not. One muscle group, maybe on this side of your body, will get stronger and stronger and bigger, and this muscle might not keep up as much. Why? It's the same for everyone if you have a spinal cord injury or not. Sometimes your muscles just get stronger than other muscles. So it might feel like sometimes like you might be getting weaker because those muscles are getting exhausted. We're all getting older and that happens. I know I say that a lot, but age plays a big factor into this. So if it's been a while since injury, since 2015, it's been 5 years. So some of those muscles might be working harder duty than the other side of the muscles. So again, get into some kind of therapy, because if you feel like your posture is weakening, you could be tilting to one side because one group of muscles might be pulling stronger and this muscle's not pulling you back equally. You might feel like you're pulling forward. It doesn't have to be side to side, it could be forward. So strengthening those muscles is an important activity to get into some therapy. You can use your 2 weeks of mobility training because you need to propel yourself. So that would be mobility training to get those muscles feeling stronger. If you do range of motion exercises or if you do pressure releases, as you do the pressure releases, try to use those muscles to pull yourself back up if you do them side to side or if you do them front to back. So there's all kinds of things that you can do to help those muscles. Sometimes getting a little FES, functional electrical stimulator, on those muscles, sometimes that will help whip those muscles back into shape. Muscles are very forgiving. They're very easy to get back if they've lost a little bit of strength. It does not take long. Muscles have a lot of memory. You know, we hear about muscle memory. They do have a lot of memory and they're pretty easy to get back. Can you please talk about hemorrhoids? The bane of existence, is it not? When we do bowel programs, hemorrhoids develop, and sometimes some people never get them. Isn't it amazing? And why some people get them and why some people get them so horribly or so severely is kind of an unknown. Now, there are some things that happen if you're not using enough lubricant when you do your bowel program. When you're doing your bowel program, you can never use enough lubricant. Try different kinds of lubricant. Most people start out with the Surgi-Lube because that's what they use in the hospital. When you put that on the glove, you'll notice a big glob of it falls off. It's very kind of liquidy. Some people use a lubricant called Astroglide. It's a little bit thicker and it's not quite as runny. You can try that. Don't use the petroleum products because they clog things up and they don't expel. You can't get rid of them. So that makes things into a bit of a mess. But lubricant as best you can. Really significantly do that. Another thing too is because you're sitting all the time, we know that truck drivers who sit all the time have more hemorrhoids. So be sure to do your pressure releasing exercises because that's going to take some of the pressure off of that area while you're sitting all the time. Another thing that's good is to watch your diet. So, get enough fiber in there. If you need a stool softener, be sure and use a stool softener, or you can add Psyllium. Now that, is usually in things like Metamucil or any kind of fiber additives. There are fiber drinks, there are fiber cookies, there are fiber crackers. The thing with Psyllium, you can go to the health food store and just buy Psyllium, take it in a glass of water, you're getting the same thing. It doesn't have any taste to it. It might feel weird in your mouth at first, but you get used to all these things. But the other thing about the Psyllium at the health food store is that, or you can order it online, you can sprinkle it on a salad, you could sprinkle it on meat, You can sprinkle it in your vegetables. You can sprinkle it everywhere and it has no taste. So it won't affect the taste of your food, but you get it in. The complication with these, and this I'm seeing more and more and more of, even when people are in the hospital, they'll be given their fiber in a little medicine cup or a Dixie cup. Read the instructions on the package. That's not enough. That's not enough fluid to dilute the fiber to get it to flow through your bowels. So when you don't drink enough fluid with that psyllium, if you're eating it with your food, not taking it with fluid, you still need to drink the fluid later because that is causing your bowel to slow down instead of to speed up. So be sure you read on the package, you need a glass of water, you need 6 ounces, 8 ounces, you need to drink that. You don't need to drink it all in one setting. Maybe you can't because of your intermittent catheterization schedule, but you can take 2 doses of it. You can split the fiber in half and take half now and half later. So you can do all kinds of things, but make sure you're drinking the right amount of fluids helps the bowels tremendously. Once you have them, if they're external, they'll be outside of your body around the rectum. You can take again that lubricated glove finger and you can reinsert them back into the rectum where they'll stay moist, which causes less complications. When they're outside of your body, they dry out, and that's when you tend to have so many complications from them. Sometimes you have person can have internal hemorrhoids and you don't really see them. You don't know it until they start bleeding. There are surgeries that you can have them removed. Think carefully about any surgery because remember in surgery, you're put to sleep. And so it can affect your breathing, which can be a problem, extra problem for people with spinal cord injury. Be sure and use, if you have them, you can help reduce them by using those tucks, which are a little pad with some ointment on it. You can put those on to help dry them out. You can use preparation H that helps shrink hemorrhoids. So get on top of them right away as soon as you can, and you can really take care of them yourself. It takes some time and you might be uncomfortable. Hemorrhoids can trigger autonomic dysreflexia because it's something obnoxious that's going on around in your body. Also, this person is preparing for a colonoscopy, and he had one of these 20 years ago, and it was the absolute horror. Yes, with a spinal cord injury, and you take the colonoscopy prep, it is just a horrific mess. Plus, you can't just sit on the commode while all this reaction to the medicine. That's another thing is if your bowel program is going on too long, it can cause hemorrhoids because you're sitting on that toilet seat and your rectum is not supported. And so all that pressure of your body weight is right there on your rectum, which is going to help dilate those vessels leading to hemorrhoids. So try to be as brief as you can. Know the time from when you put the suppository in about how long it's going to react before you get on the commode, if that's possible. But for the colonoscopy, there is some good news on the horizon in that many insurance companies now, if you have a spinal cord injury and you have to do the bowel prep the night before, they will allow admission to the hospital where you will have assistance. So talk to your healthcare professional. They can usually, the way it works is it's best to try to have your healthcare professional make the arrangements with the insurance company. They can call and say, this is a situation, this is why, the amount of help that will be needed and the complications if the person is laying in the stool too long. So that's one good thing. Another good thing is, and you have to do the whole prep because an enema does not go high enough to clean out the whole bowel as far as they're going to go. So another thing is to check into that. If you are in a good relationship with your case manager, and you can find out who that is by calling the number on the back of your card, you may or may not have one assigned to you. Ask one to be assigned to you. There are excellent resources about shifting money around, about how they can help. Maybe they can have an attendant come in the night before just to do the bowel prep for you if you can't go to the hospital. There's all kinds of resources now for doing that. So yes, that is one heck of a mess, but there are some new things that will help. Here, Douglas said, I just had a colonoscopy and my insurance paid for an overnight stay. This is happening more and more. And I think it will happen even more as more people know about it. People don't know to ask about this. It's never been allowed before. So, these are things that, it's a good thing. What do you suggest to have on hand in terms of equipment or medical supplies to be prepared for AD? Well, know your blood pressure and have a blood pressure cuff. So you can take your blood pressure. You get one of those wrist ones. You can have like a hospital kind of one. You can spend all kinds of money on one, or you can get a more inexpensive one. When you do get one, the next time you go to your doctor, take it to your doctor so that when they take your blood pressure, then take your blood pressure using your own cuff to make sure that it's calibrated correctly, that is checking your blood pressure as it should be checking your blood pressure. Sometimes when you purchase one, a different model, it can have a slightly different reading. Now, it doesn't, when you're just finding out your average, it doesn't have to be down to the exact number, because I can tell you right now, if you take your blood pressure with one blood pressure cuff and immediately take it with another blood pressure cuff, you're going to have a slightly different. So a little bit of difference, but if it's like 10 millimeters different, it's going to be quite a difference. And of course, the medication you want to have on hand if you have it. They're not going to supply you with these medications because they are very potent medications. If you're thinking, well, golly gee whiz, I might have AD someday, you're going to have a history of AD before. And as we get older, people tend to develop AD. People will say to me, Linda, I've had the spinal cord injury for 20 years. I've never had AD and I don't have it now. But as you get older, your body changes and reactions are different. And so people do develop it later in life and not just particularly in the younger years. Here's a question about preventative measurements for treatment of AD. Well, keep all the noxious stimuli away from you. That's almost impossible to do. But the question is about treatments for AD and neuropathic pains and spasticity. And that is another one of the new advancements that they're having. These are all problems in the autonomic nervous system. And so are they all related? Well, people would say, oh no, this is not spasticity or tone as it's called now. Not everybody will call it tone, so we have to call it by both. But spasticity is what everybody calls it, but they're trying to get it changed so that we're calling it tone now because that's more medically correct. So we'll use both terms. But they're all problems. And so people are starting to say, could AD and neuropathy be similar? Well, if you have neuropathic pain going through the autonomic nervous system, could it trigger AD? Well, it sure could, couldn't it? It's all in the same nervous system. And spasticity. So sometimes people get their spasticity under control and they, lo and behold, get their AD under control. So the medications right now are different, but sometimes a side effect of getting your AD under control, you can have side effects of getting something under control, and the side effect could be less pain. And so that's really kind of a marvelous thing. Or if you get your spasticity under control, a side effect could be less AD. It could work both ways. So there is some hope there. And then they're also saying about they're not receiving any treatment, no PT, no OT, no durable medical equipment. So you need to talk to your healthcare provider because, they should have had some some time in the rehabilitation setting in between. I'm going to look back. It doesn't say how old this person is. They just were discharged from hospital to home. So there should be some home health at the barest of minimum. And if you talk to your healthcare provider, you could say, you know, we need some help at home. In home health, they have to send a nurse to get any of the therapies, but the nurse can be in the background if the therapy is the key issue, but you have to have an evaluation from the nurse. So talk to your healthcare provider, because, you know, it should be a matter of just ordering the therapy. If you can talk them into getting some rehabilitation. Now, there are some healthcare policies that do not include it. There are also, and I've met many, many people, if you read your insurance policy, you might find that your insurance covers 2 weeks of rehabilitation, 2 weeks. And I meet people who have this life-altering spinal cord injury or life-altering stroke or life-altering whatever, catastrophic brain injury. I mean, all kinds of things. Oh, your insurance policy calls for 2 weeks of rehab. How do you reorganize your life in 2 weeks? I mean, you're sick. You know, how can you've been sick? You've been in the intensive care unit. Now you have 2 weeks to get it pulled together. But talk to your insurance company, because sometimes they can move the case from regular insurance into catastrophic case where there's some extra benefits. There's all kinds of different things that people can do with their health insurance. Your physician can write a letter of medical necessity and stating that they've not had any therapy and their condition's improving, because it probably has improved, or at least it's stabilized, and now they're ready to do this. So, okay, I think it's time, and I see it. I'm actually going to end pretty close to time this week. Yay. If you find that you missed the beginning of this is recorded, and so you can watch it again. Or if you want to get more information from me, please, I'm on the community on the Christopher and Dana Reeve Paralysis website. I'm on the community every Wednesday night from 7 to 8 Central Time. You can, if I didn't get to your question, you can email your question to me privately, or you can put it on the community. It's always great when people put things on the community because everybody benefits that way. So thank you for coming today. Stay safe. The COVID is still out there. It's mutated. It's far more easy to catch it even than it was before when we were all hepped up about it. So be sure, and there's in the chat box, there's the link to the community. And I thank you very much for coming today. See you next month.